Islam, being a complete code of life, offers its own social, political, and economic systems to guide human behavior. Islamic economists agree that absence of the practice of interest and establishment of the institution of zakat are the main distinguishing features of an Islamic economic system that make Islamic economics structurally different from the traditional interest-bearing economies. Sudanese Zakat Chamber (SZC) realizes that human development is a process of enlarging people's choices. The most critical choices are commonly a long and healthy life, acquiring knowledge and enjoying a decent standard of living. Standard definition of poverty usually focuses on lack of income or economic deprivation. But SZC believes poverty encompasses the lack of access to education, basic health care, or clean drinking water. In zakat collection access, SZC expanded zakat proceeds from $120 million in the year 2005 to $217 million in the year 2009. SZC disbursement on poor and needy channel has raised from 60% up to 63%, and the total expenditure on the mentioned channel in the year 2009 was $133 million with the accumulative percentage of 90%. The agricultural sector in the Sudan absorbs 90% of the workforce. Therefore, SZC has paid special attention to this sector, particularly to those who own lands and do not have access to the financial institutions. SZC has brought us a tractor and a harvester, and thank God, we have prepared 500 faddans for planting, and so far our plants are growing well. Before SZC support, we used to plant small areas with traditional tools, but now, thank God, the areas are expanded. In West Darfur, SZC has financed the agricultural schemes and associations by $70,000. In addition to the establishment of Khor Ramla Agricultural Scheme and near Titi County in area of 2,000 faddans at a cost of $235,000. The financial aid has included provision of 4 tractors, improved seeds and fuel for 500 families. SZC has also installed 250 hand-pumped wells at a cost of $132,250. Moreover, SZC has supported the poor families in the same state with 20,000 sacks of corn. In South Darfur State, SZC has financed the agricultural schemes and associations by $70,000. SZC also has supported developmental projects in Shattaya area by $100,000, in addition to provision of mobilized veterinary clinic at a cost of $200,000. Thousands of women and children in remote areas spend several hours a day collecting water from distant, often polluted sources. The safe water issue intimately linked to hygiene, education, and proper sanitation. Thus, SZC takes an integrated approach in bringing safe water to poor and needy people. SZC makes every endeavor to combat water crisis and works for the day when everyone in the Sudan can take safe drink of water. No doubt, without water, life will not exist, and water is essential for all human and economic development. Therefore, SZC has accepted the challenge of fighting poverty through clean drinking water services for poor and needy people and their animals. In clean drinking water access, SZC has implemented 1,975 projects for 595 villages at a cost of $210 million. For instance, in North Darfur State, SZC has established a Rahma agricultural scheme in Malit County in order to provide clean drinking water for both drinking and planting purposes at a cost of $86,580 for 150 families. Moreover, SZC has financed the voluntary return of displaced people by $100,000 and also has implemented training programs for individuals at a cost of $425,000. SZC has also installed a water station at Al-Ayid Jar al-Nabi County for agricultural and drinking purposes at a cost of $93,700 for 100 orphans families. Moreover, SZC has installed Abu Sundana Water Reservoir at Al Fashir suburban area for 13 villages at a cost of $94,904. In addition, SZC has supported poor families in North Darfur State with 20,000 sacks of corn. Nowadays, medical treatment represents a heavy burden for poor and needy people. Therefore, SZC has responded to help vulnerable people by providing medical equipments, devices, labs, and rehabilitation of public hospitals. For the same purpose, SZC has established a central medical treatment unit to handle serious cases and operations in Khartoum city, capital of the Sudan, and abroad. The total healthcare programs implemented by SZC were 1,095 at a cost of $59 million. The healthcare program has included health insurance for poor families, covered 2,450,000 individuals. In the same program, SZC has purchased some of precious medical instruments for public hospitals such as cardiac catheterization at a cost of $1.5 million. SZC also has provided genetic test device at a cost of $50,000. The device helps identifying type of tumors in not more than 1 hour, while it was required to send samples to Germany and the patient needed to wait for 2 weeks for the results. SZC has also provided radiological device for the Radiation Public Hospital at a cost of $324,000 and another radiological device for the Radiation Hospital in Al Jazeera State at a cost of $100,000. Moreover, SZC has provided the early breast cancer diagnostic device at a cost of $100,000 as the first device in the Sudan, which has installed in an ambulance patrolling different Sudanese states. For cardiac poor patients, SZC has purchased a cardiac operations device for the military hospital at a cost of $200,000. In addition to devices and instruments for Khartoum Cardiac Center at a cost of $680,000. Also, SZC has purchased a device for the Sudanese Cardiac Center at a cost of 250,000 US dollars. SZC, moreover, has financed cardiac operations for 25 poor children in Ahmed Qasim Hospital at a cost of 60,000 US dollars. SZC has provided Scopy instrument for renal operations for Ibn Sina Hospital at a cost of 153,000 US dollars, in addition to renal dialysis instrument at a cost of 50,000 US dollars, and diabetic instruments at a cost of 75,000 US dollars. Also, SZC has distributed diabetic test devices for poor children. SZC has provided medical instruments for Al-Tijani Al-Mahi Psychiatric Hospital at a cost of 40,000 US dollars. Refrigerators for Khartoum Hospital's morgue at a cost of 60,000 US dollars. 14 ambulances for Khartoum and different Sudanese states. Women delivery rooms equipments for rural hospitals at a cost of 245,000 US dollars. Moreover, 100 labs for AIDS and TB tests for borderer states at a cost of 20,000 US dollars. In addition to AIDS test lab for the military hospital at a cost of 37,000 US dollars. In southern states which have experienced decades of civil war, SZC during 2005 to 2009 dispersed amount of 14 million US dollars. The beneficiaries were 568,520 individuals. It is to be noted that there is no zakat collection in the southern states except in Upper Nile State. Thus, SZC headquarters financed all the southern states projects. SZC, in the access of clean drinking water, has installed 38 hand-pumped wells in Upper Nile, Equatorial, West and North Bahr al-Ghazal, Al-Wahda, and Jonglei states. Moreover, SZC has installed 36 water reservoirs, 130 groundwater wells, 145 surface water wells, 76 water tanks, 74 water reservoirs, rehabilitation of 88 water canals, 79 water reservoirs, 53 small water dams, 22 water pumps, 116 water hand-pumped wells, rehabilitation 149 water stations and pumps, 33 water refinery stations, 167 water networks, and the total number of the implemented projects in clean drinking water program were 1,975 projects. In the healthcare access in the southern states, SZC has rehabilitated 4 public hospitals in Upper Nile, Equatorial, North Bahr al-Ghazal, and Jonglei states. SZC also has provided medical instruments for public hospitals in Upper Nile, West and North Bahr al-Ghazal, Al-Wahda, and Jonglei states. In addition to medical treatment expenses for 17,593 patients, and provision of uniforms for 225 nurses for Bahr al-Ghazal Public Hospital. Moreover, SZC has built Al-Inqadh Medical Complex in Juba City. In educational access, SZC has built 6 schools in West and North Bahr el Ghazal and Jonglei states and has rehabilitated 31 schools in Equatorial, West and North Bahr el Ghazal, Al Wahda, and Jonglei states. SZC has also supported 16,703 schools teachers and provided clothing for 90,800 high and basic schools pupils. Moreover, SZC has sponsored 2,883 colleges students of Upper Nile, Equatorial, West and North Bahr el Ghazal states, in addition to sponsorship of 14,500 high and basic schools pupils in West and North Bahr el Ghazal and Jonglei states. And during the years 2004 to 2009, SZC has financed the pilgrimage of 820 Southern Muslims at a cost of $2 million. In 2009, SZC established 16 dairy factories in different Sudanese states for poor families and provided milky cows and goats for them. SZC also has supported Quranic schools by providing 168,000 sacks of corn and 2 million kilograms of flour. Moreover, SZC has sponsored 68,000 orphans, 38,000 students, also has provided a different kind of support for poor and needy people through the leader and his citizens. Month of Ramadan programs, in addition to the glorification of the right of zakat as an annually SZC program implemented in 2 states. So far, 12 states have benefited from this program at a cost of $40 million.